Okay.
You were called to the department store for a patient who has passed out. Upon arrival, you were told by store security that a young man was walking to the store, and he apparently passed out and started seizing. As you approach the patient, he's still actively seizing.
How old did you say he was?
27.
Alright, got my proper PPE, is my scene safe?
Scene is safe.
Nature of illness, possible epilepsy or seizure. I see one patient, do I have any more?
Just the one.
I'm gonna go ahead and call ALS, and I am gonna consider C-spine at this time. My general impression, I have a 27-year-old male who is actively seizing. Level of consciousness, I'm gonna go to him. Is he conscious? I would assume he's not talking.
Yeah, he's unresponsive.
Unresponsive, okay. And does he have a chief complaint?
No, but he's actively seizing.
Okay. I'm going to go into my ABCs. I'm going to make sure their airway is open and patent. How is that looking?
Open.
Okay, I'm going into breathing. I'm checking rise and fall of the chest. I'm listening for adequate ventilations. I'm also going to attempt to listen to lung sounds if possible.
They're unobtainable.
Sorry, what did you say?
Unobtainable for lung sounds.
Okay.
Respirations are very slow, shallow breathing, and it's hard to see the rise and fall.
Okay. Does he have a SpO2 reading?
Yeah, it's reading at 89%.
Okay, I'm going to go ahead and try to bag him right now and give breaths with just for PPV. And now I'm going to go into circulation. I'm going to check the pulse. I'd probably check carotid first just because he's unresponsive. And I would also check radial. How are those?
Both are strong and equal.
Okay, I'm checking color, condition, and temperature of the skin. How's that?
Pale, warm, moist with some cyanosis noted in the lips.
Okay, and then any major bleeding noted at this time?
None.
Alright, and at this point I'm going to just keep him on the floor. I'm going to make sure there's no things around him that could injure him even more, and I'm going to state that he is in immediate transport. And now I'm going to go into my history taking. Is there a sample or PQRST that someone can give me?
Yeah, you get some witnesses.
Okay. Was this seizure onset? Was it gradually, suddenly?
Approximately 10 minutes ago.
Okay, and then did anything provoke this seizure?
Undetermined.
Okay. If there's any pain, could you describe the quality of the pain to me?
Not applicable.
Does the pain radiate anywhere?
Not applicable.
And if there was any pain on a scale of 1 to 10, with 10 being the worst pain you've ever felt?
Not applicable.
And then approximately what time did the seizure start?
It's undetermined.
Okay. And are there any other signs and symptoms?
Witnesses state the patient fell to the ground and began seizing. He is incontinent.
And does anyone know if the patient is allergic to anything?
It's unknown.
Is the patient taking any medications?
Unknown, but the patient has a bracelet states that he's epileptic.
Okay. And pertinent past medical history other than maybe epilepsy?
That's unknown.
And does anyone know when the patient's last oral intake was?
It's unknown.
And events leading up to this?
Walking to the store when he fell and began to seize.
Alright, for my secondary assessment, I'm going to be focusing more on neurologically, since he most likely is epileptic. I'll probably look at his pupils. Does it know anything for those?
No.
And then I would also check the skull if there was any way he hit his head or any deformities to that.
Nothing noted.
Okay. And now I'm going into my vitals. I'm going to take my blood pressure if attainable. blood pressure was 118/62. What is that corrected?
Sorry. None.
None, okay. I would attempt to take a pulse reading and respiratory rate reading as well.
You're unable to obtain those as well.
Okay. And does it give an SpO2 reading with the oxygen?
97%.
And I would check the lung sounds again. Does it say anything about those?
It's still unable to hear.
Okay. All right, I'm going to state my field impression. I believe this patient is having a grand mal seizure, suspected epilepsy, and my treatments and interventions. I'm bagging him right now and just making sure that there's nothing that can harm him. I'm not trying to constrict him. I'm waiting for a seizure to stop, and now I'm going to give my field impression, or my report, which is, this is medic 1. We have a 27-year-old man who's actively seizing, suspected grand mal seizure. He does suffer from epilepsy. Allergies is unknown. We don't know if he's taking any medications. Witness states that he fell about 10 minutes ago and started seizing. We don't have any other information on him. His blood pressure, respiratory rate, and pulse was unobtainable. He is on, he does have a 97% SpO2 reading. Lung sounds were unattainable, and we're about 5 minutes away. And I'm also going to reassess this patient every 5 minutes.